Americans can pay $60,000 for a new knee. In Mexico, $12,000. Same procedure, advertised at a fraction of the price. Same operation, same titanium implant. A very different bill, and some Americans are getting on a plane for it. But before the plane ticket, there's a quieter question the price tag never shows. First, the ground rules. This is a cost comparison, not medical advice. We are not doctors, and nothing here tells anyone to have a knee replacement, skip one, or book a trip. Every figure comes from publicly available data. The Federal Agency for Healthcare Research and Quality, the Centers for Medicare and Medicaid Services, the Kaiser Family Foundation, and peer-reviewed joint replacement registries. Where a number is only an advertised estimate, we will say so. Start with the American price. Knee replacement is one of the most common operations in the country, about $790,000 a year, and per published projections, climbing toward $1.25 million by 2030. According to National Hospital data, an uncomplicated knee replacement averages around $60,000 in hospital cost, inside a wide band that can run from roughly $40,000 to well over $100,000 depending on the case. For someone without insurance, the self-pay price is often quoted at $35,000 and up. Now the other side. Hospitals in Mexico advertise knee replacement packages reportedly starting around $7,000 to $15,000, roughly 70% to 80% less. Same operation, same kind of titanium implant, a very different bill. Hold on to that word, reported. These are advertised marketing numbers, not independently verified, and there is no official per-procedure price. So why would anyone fly for a new knee? The math is part of it. In 2023, about 25 million Americans under 65 had no health insurance per the Kaiser Family Foundation and census. And for them, a $60,000 hospital bill is the whole bill. Even for the insured, a U.S. plan generally does not cover an elective operation in another country. So on paper, the savings are real. That is the setup. Here is the part the price comparison leaves out. We built the thing the brochures skip, a free, plain English medical travel checklist linked in the description, what to ask, what to confirm, what to bring home. And keep one question in mind because with this operation, it's the important one, not where to get a knee replacement, but who takes care of it after. Here is what the published evidence reports, and on this one, it's mostly good news. Total knee replacement is one of modern medicine's most successful operations. Across peer-reviewed systematic reviews, around 80% of patients are satisfied with the result. So unlike some procedures, the honest question here is not whether it works. It's two quieter facts. First, even with a great operation, roughly 1 in 5 patients report they are not fully satisfied. Usually from expectations the surgery was never going to meet, not a failure of the implant. And second, the one that matters most for travel infection. Peer-reviewed registry data, drawn from hundreds of thousands of operations, puts revision for a deep prosthetic joint infection at about 7.5 per thousand within 10 years. That is uncommon. But when it happens, it is serious and complex surgery, often months of treatment. None of that is a verdict on the operation. It is one of the best we have. It is simply what the studies report about the small share of cases that go sideways. That reframes the trip. The operation itself is highly successful, but if you are part of that small share who gets an infection or needs a revision, the question is not the sticker price. It is who handles it and where. A U.S. surgeon is often reluctant to take over a knee with an implant placed abroad, partly because the implant and its records may not be tracked the way a domestic registry would. A U.S. insurer generally will not pay for care tied to an elective operation performed overseas. And recovery from a knee replacement is not one appointment, it is weeks of physical therapy and monitoring. So an honest accounting includes the second bill, the return flights, the local rehab, the imaging, the time, and the what-if of a complication, 5,000 miles from where it was done. The reported savings are real, so is the possibility that more of the cost arrives later. So here is the picture, both sides on the table. The savings are real. A knee replacement is one of the most common operations in America. Millions of people are uninsured, and wanting to avoid a $60,000 bill is not reckless. And the operation itself is genuinely excellent wherever it's done well. But the risks are real too, and they are a particular kind. This is major surgery, the small chance of infection is serious, and follow-up and revision are harder to manage across a border. The honest move isn't a yes or a no. It is to know exactly what you are buying before you book. Who is accountable if something goes wrong? Who tracks the implant, and what a second bill might be? That is a conversation for you and a licensed surgeon, not a price tag. If a no-hype breakdown like this is useful, subscribe. The real cost of care, no clinic ads, no sponsors. And I want your take. Would you cross a border for major surgery to save $50,000, or does the second bill risk settle it? Tell me below. You shouldn't have to go broke to feel whole.